Whether you're an individual, organization, or institution active in international development, Development Aid is here to empower you. Procurement notices, funding and grants opportunities, lists of potential partners, insights into market trends, databases of development professionals, webinars, latest news, and much more. Don't just be active in international development. Thrive in it. Stay informed and connected. Visit developmentaid.org today and see how we can help you achieve your sustainable development goals together.
Hello everyone, welcome to Development Aid Dialogues, our new project exploring the heart of humanitarian aid's most pressing topics. I'm your host, Ishmael. We are joined today by Dara Johnston, Chief of Section for Climate Resilient Water, Sanitation and Hygiene. Dara has led numerous initiatives addressing water, sanitation and hygiene challenges in developing countries. Good morning, Dara, and welcome to Development Aid Dialogues.
Good morning, Hisham. Thank you for having me.
Dara, what is climate resilient WASH and what is its importance?
I think first we have to look at what is WASH, water, sanitation and hygiene, and its importance globally and to the global population. So it's really all about health. Having clean water is a huge challenge, and in order to keep it clean, we have to have good sanitation and hygiene. Over the past 4 or 5 decades, there's been a huge increase in the numbers of people who have access to safe water and sanitation. But there's still maybe about 800 million people don't have access to basic water, and about 1.7 billion lack basic sanitation. So there's still a huge challenge for just straightforward water and sanitation. And if we are to reach the Sustainable Development Goals by 2030, the current trend has to increase by 6 times for water and 5 times for sanitation if we were to reach these goals. But the problem that we see now in the past 2 or 3 decades is that climate change is reversing some of those trends, and some of the gains made are being lost, so that we need to employ even more tactics to ensure that the interventions are climate resilient. You see things like flooding and droughts are having huge effects on the infrastructure and the environment, which take away from many of the gains made over the years for water and sanitation.
As you have said, that climate change have some kind of impact on your work or on the water access. So are there any other things that we can talk about, like the direct impact of climate change on access to water?
Water systems and sanitation infrastructure gets destroyed by floods, and also with increasing heat, you have droughts and you have water resources. Groundwater are depleting, so that many of the, say, groundwater systems, which were quite prolific before, they're actually running out now, and you're finding that groundwater is becoming more scarce in many areas. When you have floods, sanitation infrastructure gets inundated, and there's a huge risk to the environment. And the basic latrines in rural areas, these can collapse, and so communities have to move. And when they return to the area which was flooded, everything is destroyed. So the other side, of course, as I mentioned, you decrease in rainfall in some areas. You have reservoirs and springs and groundwater drying up. And about 2/3 of the world's population experiences severe water scarcity at least 1 month a year now because of climate change.
What is the situation in South Sudan?
Well, in South Sudan, it's been experiencing floods now for about 5 years. And the rainy season has seen about a 20 to 30% increase in volume of rain, which has flooded many parts of the country. In some cases, the floods from last year have not gone away when the new floods of this year arrive. So a lot of water infrastructure has been destroyed, and you find that in many places the gains that are made in improving sanitation are completely lost. And so people go back to in the open because everything they invested before is completely gone.
And in such situation, what does WASH do?
So what we have been doing now is to introduce some climate resilient infrastructure and advocate that where infrastructure has been built, there is some analysis of the risk of flooding, for example. So in the case of the urban WASH, we're building large water treatment plants situated in areas which are less prone to flooding, but that's difficult because you usually build water infrastructure close to the water source, which is naturally an area which might flood. So typically we adjust the design so that the treatment plant is elevated, and this of course adds to the cost, but in the long run of course it means that there is a water source available even when the floods occur. With regard to other buildings, we can do the same thing. Of course, the information is needed, and that's not available as yet to be able to map out the risk areas and decide where you want to invest for the elevated buildings as opposed to the building them at the normal level. For hand pumps in rural areas, we also elevate the platform of the hand pump with a ramp going up to it. And this is proven to be very effective in areas which flood for a few months of the year. So people are able to reach the hand pump by boat, and they can still access safe water. So adjusting the designs allows to avoid the floods, as it were. Other things that we do using solar power for where we need energy for the water treatment plants especially, and also for the groundwater supply. South Sudan has abundant sunshine, so it's a very free and readily available resource, and this of course reduces the carbon footprint, and it also makes the cost of the water much lower. We've estimated that the production cost will be less than half if you're using diesel generators. So this has multiple benefits, not just for reducing the cost, but it also has a much less impact on the environment and has a mitigating factor for climate change.
Relevantly, millions of children around the world go to school with no drinking water, no toilets, no soap for hand washing. And this is making learning difficult. What do you do to help them?
So we're introducing an approach in South Sudan, working with the Ministry of Education and the Ministry of Water Resources, to have a standard at the schools whereby it's measurable how good the water and sanitation infrastructure is at the school, so that any development agency that is investing in water and sanitation schools, they can aim to reach these standards. You need to have enough latrine blocks for the population of students in the school. Typically, the global standard would be about one stance for 25 children, but we find in many of the schools it's way above 40 or 50. And in some places it's even one toilet room for 100 children. So increasing the number of toilets in the school, but also providing running water is very important, because you can't operate the toilets if you don't have water. And then of course we have to provide the children with the training, hygiene promotion, so that they are able to know how to use the toilets properly, hand wash, etc. And this has an added benefit, because when the children learn, they bring the information home, and it has an impact on the family as well.
Speaking about the hygiene, in a healthcare facility, the risk of spreading infectious disease is very high, especially during outbreaks like cholera, Ebola, and COVID-19. So what does WASH do in such situations?
So increasing the number of toilets in the school, but also providing running water is very important, because you can't operate the toilets if you don't have water. And then, of course, we have to provide the children with training, hygiene promotion, so they are able to know how to use the toilets properly, hand wash, etc. And this has an added benefit, because when the children learn, they bring the information home, and it has an impact on the family as well. Similar to schools, and probably more importantly, you can't really have a healthcare facility if you don't have clean water. Most health interventions need hygiene and they need clean water. So it's very important that the healthcare facilities have water, and that's actually even less healthcare facilities than schools in South Sudan at the moment have safe water. So again, we're promoting standards for WASH in healthcare facilities to encourage all the partners and of course the government to make sure that healthcare facilities have safe water and sufficient numbers of toilets. And of course, as in the schools and the healthcare facilities, these toilets have to be gender segregated for safety and so forth.
I have read some articles that were speaking about the importance of access to water, to safe water, and linking this to gender equality. How can we find this connection between access to safe water and toilets, poverty alleviation, and gender equality?
Well, there's a number of aspects which affect gender equality. I mean, the basic one is that in most communities, you find that women spend a lot of time collecting water. And if the water source is far away, there are huge risks for women. The risks from predators, from wild animals to humans, and simple things like snakes, if they're going far away from the homestead to collect water. But not only those risks, but they're spending a lot of their time, which could be used for other purposes, either for childcare at home or for employment opportunities. So you often find that men don't do their fair share for collecting water. So you can see that there's a big gender divide. It also has an impact on girls' education because they're very often tasked with collecting the water in the morning and the evening. And so they may be late for school or may not go to school, and they may not have time in the evening to study. So it has a lifelong effect, really. So putting water resources, putting the water source closer to the home can have a huge impact on women and girls.
What is the average distance that girls use to walk to collect safe and clean water?
Well, it varies a lot. You can't really know the average distance, but looking at some of the statistics for South Sudan, when we measure water supply, if you have a basic service, then that means that it's available within 30 minutes and it's safe. But only 9% of the population of South Sudan has this. So the remaining 61% are traveling more than 30 minutes to collect water. And in some cases, they're 12% of those cases, they're actually using surface water, which of course has great risk to their health. It's less in urban areas. About 65% have basic service. So 35% are traveling more than 30 minutes. But in rural areas, the percentage with basic access is 32%. So you have 68% who are traveling more than 30 minutes to collect water. But sometimes this is more than 30 minutes. I've been to parts of the country where women say they travel for hours. And in some cases, when they have a big household, they may do more than 5 or 6 trips a day. So the cumulative amount is very high. I've heard of areas where women have to arm themselves with guns when they collect water because of the risks from hostile elements in the area. So it's not just time that is the challenge.
Why it is women-only task? Why men are not engaged in the process of collecting water?
Oh, that's a cultural issue, really. I mean, it's a good question, and in some places, when you show these statistics, in some countries, the men, of course, say no, this couldn't be true. But we know from the surveys we've done that it is the case. It's a gender disparity, which is, in many things, you have child marriage, you have all sorts of challenges like this which are affecting women, and until you can change the social norm, this is going to continue.
So, from your experience, how do you involve local communities in WASH initiatives, and how do you employ strategies for capacity building to ensure sustainability?
So, it's different for water than for sanitation. Water supply usually requires some infrastructure construction, and this will require financial resources. So it needs to be provided externally. But for the operation and maintenance, communities need to take ownership of the infrastructure, and they need to have the knowledge to maintain it. So if you have something like a simple hand pump, it's possible to train local technician. Some of the most successful stories of that are when you're able to train women to maintain the hand pumps, because sometimes when you train the men, they're not there when it breaks, or they say when it does break, they say, oh, it's the women who have been using it, they should fix it. So there is a challenge there. So we find sometimes that it's better to train women, if the culture will allow, to train women to maintain the hand pumps. But it's also necessary to have a committee within the community to collect money from the households to repair the hand pump when it breaks. And this has to be realized from the beginning. There's no point in setting up the committee when the hand pump breaks. It needs to be set up from the point of when it's installed. So you end up with something that's owned by the community and maintained by the community. But beyond that, you need to have a supply of spare parts provided by the private sector, which is a challenge, especially here in South Sudan, when the private sector is weak and the humanitarian assistance has been very strong for a long time. So we're looking at turning that around now and helping the private sector to grow again so it's more sustainable. In urban context, where you have large water treatment systems, and you need to have a system of actually collecting tariffs or collecting a fee at the water point so that there are sufficient funds. You have people operating the treatment plant, you have chemicals for its operation, you have to pay for the electricity. Of course, as I mentioned, if you have solar power, that can be much more convenient. But regardless, there's always operation costs in the larger urban systems. So just like a developed country, you need to collect fees for the water use one way or the other. For sanitation, it's a bit different. You're not necessarily aiming at building toilets as such, but what you want to do is convince people not to defecate in the open. Of course, the solution is to use a toilet. But the reason that you want this behavior change is to remove human waste from the environment. So the solution, of course, is people use toilets. But what we found is that if we have a program of building toilets for people, when the toilet breaks, they don't fix it. They think that, oh, I can't afford that. I want the agency who built it to come back and fix it. So this has been a lesson learned over many years, decades even, that it's not the act of building a toilet, but it's the change in the social norm that you need to create, that people need to understand that they should not defecate in the open. So they build toilets the same way they build their house. And if they have a house of mud walls, then they would have a toilet with mud walls. If they have a brick house, they would have a toilet made from brick. And once they begin to have this habit, then you will find that they build the toilet closer and closer to the home, and soon it becomes something that's part of the home. So it's different from water supply, which is infrastructure. It's a behavioral change approach. Of course, in urban areas, you need wastewater treatment, but urban areas, it's a bit easier for changing behavior because you can have regulations, you can impose laws because of the density of population, but it's not possible to regulate people's behavior so easily in rural areas. So we're looking at turning that around now and helping the private sector to grow again so it's more sustainable. Urban context, where you have large water treatment systems, and you need to have a system of actually collecting tariffs or collecting a fee at the water point so that there are sufficient funds.
Why don't you make partnership with civil society organizations in South Sudan to help raise public awareness about this critical topic?
Oh, we do. We work with local NGOs, and it wouldn't be possible without local organizations to reach out to the remote communities. And in some areas, especially South Sudan, they have many different ethnic groups, so the language barrier alone is a challenge. So you need to partner with local organizations and especially with local government in order to be able to even just communicate with the communities.
I have an experience in South Sudan, and I see that the bureaucracy is a barrier for making a concrete development. How do you deal with this?
Well, we work closely with government at national and state and even at county level, because we're not here on our own. We're partnering with government and we're supporting the government all the way. So it's very important that we're working hand in hand with them wherever we have programs. At this national level, we are helping the government to develop standards and guidelines, and then to disseminate them at state and right down to the village level where they're being implemented. If it's not something that we're doing together with government, then when we're outside of our mandate, our job is to support the government and help them to develop the country. But yeah, I mean, every country, every government, you're going to have bureaucracy, you're going to have challenges, and that's part of the part of the work. You have to help them to be more efficient and to have regulations which are more effective. And that's always an ongoing process. We're currently working with the government here to review the water bill so that it can become an act in Parliament, and that will streamline many things around the country in the sector. We're also helping them to review the policy, and this will be something which have to involve all the stakeholders, so the NGOs, the CSOs, and even communities and the different stakeholders such as the women's groups and youth all need to be involved with these kind of reviews.
Could you elaborate on your involvement in the formulation of policies and your advocacy efforts about water sanitation and hygiene issues at both domestic and global scale?
Okay, so for the water policy that has been developed is quite straightforward, really, laying out the roles and responsibilities of different layers of government. It's connected to targets which the government wants to reach. For example, the government wants to have the country open defecation free by 2030. So in line with that, we've worked with the sector to develop an open defecation free roadmap, which details how we would achieve various stages of this goal by 2025, 2027 and 2030. And this allows the government to plan and the other sector partners to plan for how they will work together to achieve this particular goal. So this allows us to have a clear strategy as we move forward so that all the partners are moving in the same direction.
Outside of your professional life, do you have any hobbies or interests that you feel have contributed to your work in WASH?
I'm very interested in environment and climate change. I read a lot about that, so it became something critical for WASH. Was fortunate. I find it very interesting, the whole science of climate change, and of course it's had a huge impact on water and sanitation. So that's one area. Perhaps another area is photography. I like to take photographs, which is very useful for my work. Rather than taking notes, you take a photograph of a certain situation and you can look back at it when you're sitting at your desk. It reminds you of what you encountered and what the ideas are that came from that. Yeah, and that would be the two that I would say.
Working in areas where people are suffering is a challenge, accompanied by a shortage of professionals and essential needs. How do you maintain your passion and the drive for your work in such circumstances?
Yeah, it can be a challenge. It can be quite daunting when you see, when you hear of how people are suffering when they're going with very limited amounts of water and suffering from sanitation-related illnesses. I think you can draw strength from when you have a big success, when you complete a large infrastructure program, when you see the water is flowing at the kiosks and you see people are able to get water more effectively, much lower price. When you go to communities and when they've changed their sanitation behavior, and you see their understanding now that by changing this behavior, now they have better health and better dignity, and girls can go to school, etc. So when you see those changes, it motivates you. But it can be quite daunting when you look at especially the humanitarian context, where you see people fleeing from floods, or what is happening now sometimes is fleeing from conflict. So
It has been an absolute pleasure having you on Development Aid Dialogues. Your insights into the WASH sector, the challenges it faces, and the strategies to overcome them are truly inspiring. Your dedication to improving access to water, sanitation, and hygiene in developing countries such as South Sudan is admirable. Thank you for sharing your experience, your passion, and your vision for a future where everyone, everywhere has access to clean water, sanitation, and hygiene. To our listener, thank you for joining us on this episode of Development Aid Dialogues. We hope you found this discussion as enlightening as we did. Stay tuned for more conversations on pressing topics on humanitarian aids. Until next time, this is your host, Hisham Alam, signing off. Thank you, Dara.
Thank you.
Thank you. Goodbye.